Nice to see you.
Welcome, and you. Come and sit down.
Today is one of baby Barnaby's first visits to the GP. Mum Megan says when she first moved to London, she looked around to find a practice she was happy with.
I've always been able to get an appointment. You can get an appointment on the day. You can book appointments in advance. I know that some of my friends who have GPs in sort of neighbouring areas haven't had the same kind of service.
In fact, that's the kind of picture suggested in a new report. It says there are big variations in quality of care depending on where you live.
Take flu vaccination. In Newham, nearly 60% of those at high risk get immunised. In Havering, it's around 35%. But Havering GPs perform well when it comes to breast screening. Nearly 80% of women are being screened. Compare that to 59% in Hammersmith and Fulham. And Tower Hamlets, one of the most deprived areas of London, has been praised for tackling high levels of diabetes.
Despite some practices serving very deprived communities, they're actually bucking the trend and providing really high quality care. What we're arguing is that general practices need to work more together to look at their priorities, where they can improve care and learn from each other.
The report also says more needs to be done to recruit new doctors. In some parts of London, 1 in 4 GPs are over 60. This Lambeth GP agrees that would help, but says practices face huge challenges because of a diverse and developing population.
You've got areas where there's high population turnover and some 20% of your patients are changing every single year. And how do you offer continuity of care and the sort of quality that they were looking for in that report when you've got that level of turnover?
And the group that represents thousands of London's GPs says they need investment and support to bring about change.
More doctors, definitely more practice nurses as well, better training and support from community services which have been decimated.
As London's population gets older and budgets get smaller, the challenges facing the capital's GPs will continue to grow. Sonia Jessup, BBC London News.